Good evening, dear students and the faculty. It's a great pleasure that I am speaking to so many students today, and I'm really very, very happy. This just shows the enthusiasm of all the youngsters for this extremely exciting program that has been started by the Indian College of Anesthesiologists called as the Olympiad 2025. Students, for all of you to know about Indian College of Anesthesiologists, this is a completely academic body which deals only with academics and nothing else. It's for the promotion and of all the activities of the postgraduates and all other seniors as well. This was started in 2008, and there are many senior faculty from the national faculty as well as international faculty who are members and who contribute to the college. We have a national dean, we have an international dean, we have the president, we have the CEO, we have a patron, and all of them as a working committee work very hard to make our programs successful. To name a few, to you all, you may not know, we have been having regular webinars. I think many of you know every Wednesday at 7 o'clock, right at from the time of COVID, that is 2020, and they have been conducted consecutively every Wednesday. We cover different topics. There are PG discussions and lessons. There are case discussions, which are very beneficial to all the students. So, students, I'm so happy you are here today. And this is a new venture that we have started, which is the Olympiad 2021. This is really to sharpen your, not the brains, but all your mental acuities to see how well you appear, where you are placed in among your friends for the next entrance exam, or where you stand in your academics. And this is actually a brain teaser, and you don't really have to worry about it. It's You should take it in a very positive way how it is being conducted. This is the first one. We have the preparatory class today. Dr. Saneesh has taken a lot of effort for this, and I really congratulate him. And I think, Saneesh, we can go ahead and now tell the students what we plan to do. Of course, today is only preparatory, but please go ahead.
Okay, thank you very much, ma'am. I'm Dr. Saneesh. I'm sitting in Trivandrum and speaking to you thanks to the technology. And the exam we are contemplating to or planning to do on April 6th is again an online exam where you'll be comfortably sitting in your home, in your study room, and then taking exam. So in our panel, we have, apart from our President ICA, Dr. Jayashree Sood, Dr. Baljit Singh is there, our CEO of ICA, and other faculty. Baljit sir, would you like to say a word to the audience?
Well, Dr. Saneesh, I think let's participate with the students with regard to the academics. So I wish the students all the very best in the forthcoming events. Today, of course, is a kind of introductory as to how the program will go. Please carry on, Dr. Saneesh. You have done a wonderful job, and I think congratulations to you for all the effort that you have put in to bring this on platform. Please go ahead. Thank you so much.
Thank you very much. And we also have our faculty members for the preparatory classes. So I can see Dr. Abhyuday, Dr. Rashmi, Dr. Arvind Narayan, Dr. Srividya, and we have more faculties lined up for the subsequent classes. So before we start, let me tell you what exactly is ICA Olympiad, because that is very much important, because I happen to take all the feedback. Many people ask whether it is an online quiz. The answer is no, it's not an online quiz. It is not something that you take as a team. It's individuals competing. It's a peer group exam. Even the school kids take Olympiad exam. So why not within our postgraduate students, the residents, we are planning an online objective type examination where you will be taking exam, sitting at the comfort of your study room or hostel room, whatever. But there are some requirements. So basically, 10 o'clock, April 6th onwards, the game starts. Before that, you have to validate and enter. I'll tell you how to enter that. And then you will be given 100 objective type questions, 100 questions. And the duration of exam will be 2 hours. Clear? So out of 100 questions, we'll have three sections. Section A, single best response, where out of the four responses, only one will be the correct answer. You need to choose the single best answer. You can't choose the near to best, you will lose the marks. +4 for the correct answer and -1 for a wrong response. If you don't answer, 0 marks. Clear? That's what happens in our regular entrance exams. But when it comes to section B, things will be slightly different because more than one responses will be correct. We'll be giving some examples. Okay. So out of four, maybe two may be correct, maybe three correct, or maybe four, all four correct. Again, they will be implementing what is called as partial scoring system. So if there are three options, you pick all three, you tend to take the full points. But if you go wrong in one of these, then you will be penalized. So that this scoring system details we'll brief you on the day 3, where we'll have our technical IT expert also. So there we'll clarify. But right now, understand that section B will have the partial scoring system. Section C is different. There will be two statements. One is assertion statement and there is a reason statement. And we'll try to find out the collaboration between. There are some choices. So how to take ICA exam, ICA Olympiad exam? Sit in your study room. Study room means it is a quiet room. Okay, you can have noisy background because your microphone and the webcam will be on throughout your exam. Your full screen is going to be recorded for some time. Okay, during the 2 hours, and it will be kept for some time to clear the disputes and all. So what you need to join is a laptop or tab. There should be a webcam. It should be working because you need to validate yourself with a photo ID card. How to do that, I'll tell now. Your microphone will be open throughout. So you can't read out the question and somebody cannot tell you the answer. And fast internet connection is mandatory because we are not responsible for your connectivity issue. Okay, better not to connect through your mobile tethering. Better find a place where you get a seamless internet connection, preferably broadband connection. And how we do online proctored exams? The exams will be proctored by artificial intelligence enabled technology, where even your lip movements, eyebrow movements, everything will be scanned. Don't worry about who scans and all. If you are dedicated, reading the question, answering, no problems. But if you are seem to be talking, then there will be an alert message on the screen and 3 alerts, then your response sheet will be auto submitted. Technically, you will be out of the exam. Okay. So no foul plays allowed. There will be a human proctoring also to make our system more sturdy. And probably if you are having any problem, you can communicate through the human proctoring person through chat. Okay. If he has any issue, he'll chat. That chat window will be active over and above the question window. And then you can clarify that. So throughout 2 hours, your full screen will be recorded. So there is no scope of adding and opening another window. There is no scope of looking into a second device because your eye movements and lip movements, everything will be screened. So this is the era of artificial intelligence. Let's see how it works. Okay, what you need to keep ready on that day, you need to have a photo ID card. I know many of my friends who actually cleared their theory or their course duration is over, but they were pursuing post-graduation as on 1st of January. They may not have their ID card. They would have surrendered their ID card. So the next best option is show your photo ID card, any government authorized photo ID card, your driving license or your Aadhaar card or even your passport. It should be a photo ID card and That should be validating your identity. Okay. Rest of the things will be validating through our user ID password method. Correct? Those who are pursuing post-graduation now, you can use your institutional ID card with photographs as well. So that is mandatory. The environment should be noise-free. There will be a system compatibility test. So what is that? We'll come to know during the mock exam session. We don't keep it till April 6th. We'll sort it out on April 2nd and 3rd, where the IT people have promised that they will open the platform for all the delegates. So whenever you are free, do this mock exam exercise, like log in with your user ID password, show your ID card, see how it is validated, how it checks your system, whether your internet connection is okay, your background noise is acceptable. So everything you can sort out in April 2nd and 3rd, but April 6th, Sunday is the exam day. Okay. During exam, you can look for warnings from the AI or human proctoring system as on-screen messages or chat messages. No second electronic gadget or phone is allowed. So your full screen should be shared for recording. And now about the last tiebreaker rules. There is always a possibility that many people can have the same scores. At least for the first 50 or 100, we don't need tied scores. So I mentioned there will be three sections, section A, B, and C. So section B, I already mentioned, has partial scoring system because there are multiple responses. In case of a tight score, marks in section C gets the top priority. That is the assertion reason type, because that is again hard-earned mark, followed by section B. So if the marks are tied in section C and B, obviously section A also, it will be tight score. So now how to do the tie breaking? If the scores are tied even after this, the faster submission of answer gets better weightage. That means the duration of exam is 120 minutes, 2 hours. So if somebody has secured 417 marks and submitted at 108 minutes, and other person getting the same score submitted at 118th minute, the faster submission gets a priority because it is a competitive exam. It's a elimination test rather than a qualifying test. So these are the rules for ICA Olympiad. I hope things are more clear. This is not a quiz program. This is an individual exam, objective type exams. So in this meeting, you can keep on putting your query in the chat box. Okay, we'll be looking into that. Yes. Can we use MacBook? Yes, MacBook is fine. Okay, now we are into discussing some sample questions. So with me, Dr. Abhyuday from AIMS Patna and Dr. Rashmi from UCMS Delhi with me as faculty for this session. Welcome, Dr. Abhyuday and Dr. Rashmi. So this is about section A. First, we'll go to section A, single best response. You will get 4 options. Whichever seems to be the best, you can click and that will get you 4 marks. Right now, there is no score. So it's a free hit, and whatever you respond is going to be an anonymous response. Okay, only you will be knowing whether you got it right or not. So feel free. This is a preparatory session. So here we go. The first question. Who defined the modified Mallampati classification? Who defined the modified Mallampati classification? Our faculty members in the panelist group can also contribute. So it will be a welcome chain. Fine. So Samson and Young. Okay, clear? So Sheshagiri Rao Mallampati was the one who proposed the classic Mallampati classification. Cormac Lehane is a distracting choice because that is a laryngoscopic view, and Samson and Young suggested the class 4. Okay, can somebody through chat say what is the contribution of Vijay Lakshmi U patent? Okay, these are only sample questions. Chat window is open. Okay, second question. Which of the following is or are objectives of pre-medication before surgery? If you are joined through a mobile phone or iPhone, all the options will be more readable through your mobile device. Okay, I think if everybody has responded, I'll reveal the responses. Don't look at others' response. Be genuine because this is a practice session. Practice session, you should be genuine. Exam, you should be more genuine. Okay, yes, majority seems to be going in the right direction because except none of these. Objectives of pre-medication definitely include reducing the regurgitation or aspiration risk. Anxiolysis, definitely yes. Anti-secretory, whenever it is applicable, definitely yes. So except none. So right from our entrance time, whenever you get all of these or none of these, people have a tendency to go with it. Okay. Since you are pursuing post-graduation and many are already cleared theory, we should remove those thinking and be more clear with your subject. Okay, fine. So these are only sample questions. Okay. Third question. Which of the following predictors is likely to be associated with the lower incidence of perioperative nausea vomiting? Female gender, use of fentanyl for pain relief, patients with a history of smoking, patients undergoing laparoscopic surgery. Simple questions, right? So any competitive exam, simple questions are something that you need to be worried about because all your peer group people are going to score of it. Okay, so you need to be careful not to miss out on those things. Yes, patients with a history of smoking. Non-smoking is a risk factor for postoperative nausea vomiting. Can you text me through the chat what is the scoring system for PONV? Scoring system for yes, yeah, okay. With or without spelling mistake, that is accepted. Because objective type, you will be only clicking the option. Perfectly fine, perfectly fine. So I think we are dealing with an intelligent crowd. If pressure in a full nitrous oxide E cylinder is 745 psi at 20 degrees Celsius, the pressure in a half full cylinder will be about dash psi. Too simple? Let's see. Yes. I think many people are yet to answer. So these are first year of residency questions. No? First year we learn about this machine, cylinder. Okay. So should I explain further? Because nitrous oxide is not stored in the cylinder as a gas. It's a liquid at 20 degrees Celsius with a saturated vapor above that. So until the last drop of liquid vapor gets converted to nitrous oxide vapor, the pressure inside the cylinder remains its full pressure. That is 745 psi. We are speaking about the OT temperature 20 degrees Celsius. So even if it is half full, one third full, one fourth full, the dial is going to show the value of 745 or 750 consistently. The moment it starts to drop, understand that no more liquid is present. It's almost empty. Hope it is clear. So next question, incorrect statement regarding the mechanisms of an ambu bag. It contains a non-rebreathing valve, same as the circle system. It is capable of delivery of nearly 100% oxygen concentration. It allows positive pressure ventilation. Patient valve has low resistance to both inspiration and expiration. So MCQs, you always need to look into whether you are asked about a correct statement or incorrect statement. Look into these keywords, correct, incorrect, true, false, all except like that. So here there is a phrase called incorrect statement. So no point reading it in a hurry. Understand each segment of the question. Just understand the question. Okay. At least it's not a brutal majority. So it's surprising ourselves. Who has found a non-rebreathing valve in circle system? Circle system, it's unidirectional valve, but it cannot be mentioned as a non-rebreathing valve. You agree? Statement A says non-rebreathing valve same as circle system. Circle system valves are totally different from what you get in manual resuscitator or ambu bag. Okay. Statement B is absolutely correct. It is capable of delivering nearly or 100% oxygen. It is capable. Definitely your minute ventilation should be less than the total input of oxygen. If you hyperventilate, there will be air entrainment. FAO to 100 cannot be reached. But if your ventilation is less, you give adequate time, then 100% is achievable. So statement B is correct. C, it allows for positive pressure ventilation. Yes, that is exactly the use of ambu bag. Patient valve has low resistance to both inspiration and expiration. That's also true. So the incorrect statement is statement A. It contains non-rebreathing valve, same as circle system. That is the catch. Clear? Fine. Okay. Fine. So we'll go to the next question, question number 6. The responses are on. Fine. An important consideration in using the subclavian approach for central venous access. Okay. Subclavian approach for CVC. Statement A, ease of compressibility if a hematoma or laceration develops. Lower risk of pneumothorax when compared to internal jugular approach. C, ability of the vessel to remain patent in the setting of hypovolemia. And D, increased risk of damaging brachial plexus when compared to internal jugular approach. Okay, looking into the response column, feel a uniformity. Out of this many delegates, why many people are not answering? Because all your responses will be anonymous. Okay, only you will be knowing whether you are getting it right or not. Keep practicing, because your attempt can fail, but never fail to attempt. Okay. Fine. Yes. The correct answer is C, ability of the vessel to remain patent in the setting of hypovolemia. Risk of pneumothorax compared to jugular approach is higher. Ease of compressibility in a case of hematoma or laceration during subclavian puncture. No, you can't compress. Increased risk of damaging brachial plexus when compared to internal jugular approach. No. So the correct answer is the ability of the vessel to remain patent in the setting of hypovolemia. Okay. I hope the answer is clear. If you have any clarification required, you can put in the chat box. Okay. Now I think it's over to Dr. Rashmi. Right. Please take over.
Okay. So the next question is increased alveolar arterial gradient can be caused by. And you can see the options on the screen. Endotracheal intubation, second gas effect, decreased cardiac output, and atelectasis. Please answer. Okay. So there is a confusion I can see in answer number C and D. So the correct answer is option D. Okay, because atelectasis will cause the changes, there will be reduced perfusion, reduced ventilation, and therefore this will lead to increased alveolar arterial gradient. So can we move ahead to the next question?
Yes.
So the next question, single best answer. Pre-oxygenation of patients during induction of anesthesia is done to prevent atelectasis, decrease the apnea time, prevent oxygen desaturation, and shorten the safety margin. Read the options carefully, read the question carefully.
So, responded.
Right. So here we can see that majority have answered it correctly. And in fact, pre-oxygenation will increase the apnea time, right? And saturation of lungs with oxygen can lead to atelectasis, so it will not prevent atelectasis. So there is only a few responses in favor of B, which I think they were confused because it increases the safe apnea time. So let's move to the next question. What is true regarding airway closure? So this shows that there are 3 responses which are wrong and only one is correct. So please choose the correct answer, the option which is true regarding airway closure. Last few seconds to respond. Yes, so I think the responses are revealed in between. Okay. So here we are getting the majority is answering in the favor of reduces ventilation of the affected alveoli. Reduces with increasing age, reduces with induction of anesthesia. Yeah, so that's the correct answer. Airway closure will reduce the air ventilation. That's the correct answer. So we can move on to the next. Now here, this is a little bit confusing. Here we have written, the question is choose the incorrect statement. So sometimes you might get confused if you don't read the instructions in the question correctly. So please be very careful while reading the question and then pick your statement. Choose the incorrect statement out of these 4.
Yeah.
Can we reveal the responses? Okay, so here so let's move on to the next question. Causes of hypoxemia during anesthesia include. Choose the best, one single best response. So we are still at the single best response type questions.
Hypoxemia is a favorite topic. Hypoxemia, atelectasis, ventilation,
respiratory
perfusion.
system. I
Yes.
think respiratory system is more about hypoxemia, hypercarbia only.
Okay.
Yeah, so what is the answer? So we are getting it causes include impaired diffusion. Very good. Right.
But
So
message to those people included in the 1, 9, and 23, we should check the answer again. Okay, leisurely, because it's all practice part. Fine.
You get
So
confused because see, in option C, you are confused because right to left shunt will cause hypoxemia. So a little bit change or play with the words is what confuses with the correct answer. So that was only to distract you. Well, can we move on to the next question,
yes,
please?
So this question is about a 70-year-old female patient. She is a case of sepsis and is posted for exploratory laparotomy. And after induction of anesthesia, the mean blood pressure fell down to 45 millimeter of Hg with a heart rate of 120 beats per minute. And you are also monitoring non-invasive cardiac output monitoring is there, and you found it that the cardiac output is 13 liter per minute. So, which of the vasopressor you are least likely to use? Which is the least likely vasopressor in this case? When the cardiac output is 13 liter per minute, there is tachycardia and there is low BP. The options will be.
since the question was large, I split it into two slides. So before I go to the question slide, so I think all the candidates have read the question. So now we'll go to the options. Okay.
So the patient was having low BP, tachycardia, and cardiac output was 13 liter per minute. You have to use which of the vasopressor you will not use. Okay, so we are ready for the responses, and the correct answer is dobutamine. And the reason is that, see, this is a case of sepsis. In early sepsis, the cardiac output is more. And when cardiac output is more, there is no need of a drug which have a beta 1 action. So so dobutamine is having mainly beta 1 action, so it will not be used. Other have alpha actions. So alpha 1, the vasopressors that have alpha actions can be used, and the best drug would be phenylephrine, obviously, because it does not cause tachycardia, as well as it is a pure alpha 1 agonist. So the correct answer is dobutamine. It should not be used in this case. Next question, please. So this patient, another patient is having continuous flow left ventricular assist device in situ, and that patient is posted for surgery. Monitoring of which of the following parameters is likely to be difficult in this patient? So the patient is having continuous flow left ventricular assist device, LVAT, and you are monitoring the case under anesthesia. Which of the following monitoring will be difficult to do in this case? Options, sir. Okay.
Interesting response.
The correct answer is blood pressure with blood pressure cuff. See, in a patient who is having LVAD, left ventricular assist device, there are two types of LVAD. One is with continuous flow, other with a pulsatile flow. But nowadays, most of the LVAD devices are of continuous flow. So in the continuous flow, you will not get any waveform or any pulsatile movement of the arteries. So blood pressure is usually measured with a pulsatile flow when you use a blood pressure cuff. So it will not be effective in this case. While arterial line, you will get even if you will not get a pulsatile flow, but you will have a mean blood pressure where you can measure the blood pressure. PA pressure will not have any effect, as well as temperature probe will not have any effect. Related to this LVAD, there is also a device called this. See, you can go to the next question. So the next question is, a COPD patient covers a distance of 450 meters in 6-minute walk test. You must have heard about 6-minute walk test. So what is the expected maximum oxygen consumption, VO2 max, in ml per kg per minute? So you have performed a 6-minute walk test in a patient of COPD, and that patient walked for 450 meters. And you have to calculate the VO2 max, expected VO2 max. Options, sir.
Yes.
Okay. So what you need to do, the patient was able to walk for 450 meters. The simple formula is that you have to divide it by 30. When you will divide it by 30, it will come 15. So when you will divide 450 by 30, the answer is 15 ml per kg per minute. The idea is of VO2 max is that 1 meds is equal to 3.5 ml per kg per minute. So if a patient is walking 450 meters, you can easily calculate that the VO2 max will be 15 ml per kg per minute. That will be roughly around more than 4 meds. So if a patient of COPD covers a distance of say only 100 meters, then VO2 max will be 100 by 30, that comes to around 3.5. So only 1 meds, like that. So this can be asked, you can be asked either VO2 max or you can be asked meds also in that case. So the correct answer is 15. So the next question is, a 70-year-old patient is undergoing coronary artery bypass grafting surgery in which obviously heparin is used, and we have used 20,000 units of heparin. Then how much protamine should be administered to completely reverse this action of heparin after 30 minutes of administration of heparin? Heparin, we have used 20,000 units. How much protamine is needed to reverse this action? Good. So most of you are correct. It's 200 milligram. How we calculated is that we have used 20,000 units of heparin. So 100 unit is equivalent to 1 milligram of heparin. So it will come to 200 milligram of heparin, and protamine used to reverse heparin is same. You can remember like that. 1 or 1.5 milligram of protamine is needed to reverse action of 1 milligram. So for 200 milligram of heparin, roughly 200 milligram of protamine will be needed. So the question is, which of the following ECG leads is most sensitive to detect an anterior wall myocardial infarction? The options are V5, V4, lead 2, V2. Okay. So the correct answer is actually V5. V5 is the most sensitive lead that can detect anterior wall MI, and the sensitivity is 75%. V5 is followed by V4. But what we do actually in the OT, in the ORs, that we monitor lead 2 as well as V5. So when we use lead 2 and V5, why we use that? Because when lead 2 is used to detect arrhythmia. So for detecting arrhythmia, best lead is lead 2, and for anterior wall MI, it is V5. And when we combine both of these, the sensitivity comes to around 80%. And if you will combine more leads like lead 2, V4 and V5, the sensitivity will increase up to 98%. So whenever the leads are combined, the sensitivity increases. But the single best answer, which single lead is the most sensitive, that is V5. Okay. Thank you.
That's the strategy we should be aware. Okay, if anybody has not joined Menti so far, one more chance. You can simply scan the QR code or www.menti.com. This is the code 53926492. So now we'll move on to section B. Here we need to be more careful because more than one response, correct response may be there. I mentioned about partial scoring. The details about partial scoring we'll discuss in future sessions. Okay, we'll go to the first question. Drugs causing pain on injection, intravenous route. Thiopentone, propofol, cisatracurium, proctoring. So if there are two correct responses, you are supposed to click both responses, then only you will get full score. If you click only one, you will not get full score. Okay, because wrong response, you will get penalized. So that is something special about section B. So you can click more than one answer. That's what I mentioned. Don't stop with one. Okay. So next question you need to be like, it's multiple response I mentioned. You should be able to click more than one. So propofol and rocuronium are the drugs causing pain on injection. Okay. Yes. So this is question number 2. Okay. Side effects of anticholinesterase drugs include Excessive salivation, increased bowel motility, bradycardia, bronchodilation. But here we won't be able to know who chose the combination. We won't be able to know, but we'll go for the trend. Okay. Side effects of anticholinergic esterases. Excessive salivation, yes. Increased bowel motility, yes. Bradycardia, yes. Bronchodilation, no. Okay. So the correct response should have been A, B, and C. Okay. So this is the way we should be answering. If you have answered A, B, C, D, for the D part, you will be penalized. That is the partial scoring. Management of intraoperative bronchospasm. I think, Dr. Rashmi, your question?
Yeah.
The respiratory system.
So the next question says management of intraoperative bronchospasm includes provision of 100% oxygen, deepening the plane of anesthesia, reducing the concentration of inhaled anesthetic, and administration of succinylcholine. So this is multiple correct answer question. You can select more than one answers in the present format. But in the Olympiad section, as sir has already mentioned, there will not be time allocated to each question separately. So what I see is provision of 100% oxygen is the correct answer. Deepening the plane, yes, it is the correct answer. Reducing the concentration of inhaled anesthetic is the wrong answer because the plane of anesthesia needs to be deepened as well as the concentration of inhaled anesthetic delivery needs to be increased to relax the muscles, the bronchial muscles. And D is administration of succinylcholine. Succinylcholine administration will help in laryngospasm and not in bronchospasm. So C and D are the incorrect options and A and B are the correct options. So you will not be given marks, and in fact you will be penalized for answering part C and D in this question. A and B was the correct answer.
I think the confusion between bronchospasm and laryngospasm, at least
Yes.
our audience should be clear. Laryngospasm is a
Yeah.
different entity, bronchospasm is a different entity.
It was purposefully given. This administration of
These are the
succinylcholine was
distractors.
purposefully kept as an option to confuse and distract you all. And I think it served as a good distractor.
Popular distractor. Okay.
Okay. The next question.
Yeah. Which of the following are ECG findings of pulmonary embolism? Sinus tachycardia, left axis deviation, right bundle branch block, S1Q3 T3. Let's check the answers. Oh, again, good distribution, symmetrical. Okay, inverted bell-shaped curve. Okay, sinus tachycardia, yes, I don't think there is much confusion about it. About S1Q3 T3 also no confusion. This right bundle branch block pattern is also seen in pulmonary embolism. So the B should be left out. A, C, and D. That's the answer key. Clear? Pulmonary embolism is a favorite topic, whether you go for a quiz or any exams. Okay, even in Viva, we get elaborate discussions on pulmonary embolism. The next question. Which of the following beta blockers are suited for a patient with bronchospastic disease? Combining entirely different areas. But being candidates, we need to face the question. Propranolol, metoprolol, acebutolol, bisoprolol. Oh, good. Okay. Very few people went for propranolol. Oh, propranolol count is going up. Yeah. Anything other than option A is acceptable here. But to get full score, you need to click on option B, C, and D. If you click option B, C, and D, you are going to get the full score. Otherwise, your score will be truncated, desiccated, terminated, so it will come down. So A is wrong answer. B, C, D are there. So now we go to the new area, section C, where you need to put in your energy and exercise your brain. So there are going to be two statements. First one, we'll call it as assertion statement that will be labeled as A. And there will be one more statement called reason type that will be labeled as R. Okay. Now your first task will be to check whether the assertion statement is correct, reason statement is correct or not, both correct or not. If they are correct, next you need to check whether the assertion statement is actually explained by the R statement or reason statement. Then only this title of assertion and reason will hold good. I hope it is clear. There will be two statements. A, assertion statement, that one statement. Next R, this is a reason statement. First, we need to check whether A is correct or not, R is correct or not. If it is not correct, anyway, it's not going to explain. So if both are correct, we need to check whether the statement R explains the statement A. So this is our task. Checking correctness of each statement and then the interrelationship between these two if both are correct. If assertion is wrong, reason cannot explain. It's logical. I hope this is clear. We'll go with some examples. So assertion, reason, these are the four options. Both assertion A and reason are correct statements, and reason R is the correct explanation for the assertion. That is the option A. Next choice is both assertion and reason are correct statements, but the reason R is not the correct explanation of the assertion A. Okay, both are correct, but they are not explaining, like reason statement is not explaining the assertion statement. Next option, C. Assertion is correct, but the reason is incorrect statement. Option D. Assertion is incorrect, but the reason R is a correct statement. So these are the four combinations you are going to face in section C. So you need to watch out for the two statements, assertion statement as well as reason statement. We'll take an example here. Section C. Okay. The assertion statement A states that nitrous oxide administration is contraindicated in patients with pneumocephalus. Nitrous oxide administration is contraindicated in patients with pneumocephalus. Right or wrong is our first job. Reason statement R says nitrous oxide is 34 times more soluble than nitrogen. Is it correct or wrong? Now you go to the combination. Okay. So let's take a minute. Two statements. Nitrous oxide administration is contraindicated in patients with pneumocephalus. Reason statement says nitrous oxide is 34 times more soluble than nitrogen. So if statement A is correct or not, statement R is correct or not. If you feel both are correct, whether they are explaining, like R is explaining A. If both are not correct, only A is correct or R is correct. That is the exercise. So One thing to be noted is out of 100 questions, all questions carry equal mark. But section C, you need to spend your time and energy to earn the marks. That's why it is getting more weightage in the tiebreaker. So majority believes both A and R are correct statements and R is the correct explanation of A. Okay. 32 believes it's not the correct explanation. Correct explanation is something else. Both are correct. 10 candidates, delegates believe that first statement is correct. That is nitrous oxide administration is contraindicated in patients with pneumocephalus. Yes. Yes. But R is incorrect statement. One person believes that nitrous oxide is not contraindicated in patient with pneumocephalus. Surprising. Okay, but he agrees with the second part. Nitrous oxide is 34 times more soluble than nitrogen. Actually, both the statements are correct. And because nitrous oxide is more soluble, it tends to diffuse fast into closed cavities. And if it is not a compliant cavity, it tends to increase the pressure. Pneumocephalus, if the cavity pressure is increased, that will have pressure effect on the adjacent brain tissue. That is why nitrous oxide is contraindicated in patients with pneumocephalus. The blood gas partition coefficient of nitrous oxide is 0.42 or 0.46, and that of nitrogen in air is 0.014. So it is far soluble. So it tends to diffuse into the cavities where nitrogen or air is there. So nitrous oxide gets into those cavities, fills it up. Either it expands or it increases the pressure on the surrounding tissue. So statement A is correct, statement R is correct, and that is the R actually explains the statement A. I hope it is clear. I think need to read carefully into these two statements. So we'll move to the next example. Assertion statement says remifentanil infusion is preferred in case of long duration surgery. Recent statement says remifentanil is known to cause hyperalgesia. Remifentanil infusion is preferred in case long duration of surgery. That is our A statement. Our statement is remifentanil is known to cause hyperalgesia. Now we go to this dashboard. I think this question requires only 30 seconds to respond. We are almost reaching 9:30. Yes. Feel free to put your response because these are only model questions. So you will get enough and more resources to practice this kind of questions. So we have divided the full syllabus into 4 modules. This is only an attempt to make you familiar with the pattern rather than the subject proper. Okay, we'll look into the answers. Yes, both A and R are correct statements, but R is not the correct explanation of A. That is the majority. Majority wins this time? Yes, I'll go with the majority. Definitely, it's preferred in case long duration surgery because its context sensitive half-life is steadily low, irrespective of the duration of infusion. It causes hyperalgesia. That's a clear statement. We need to go for multimodal analgesia, or before we switch off remifentanil, you need to institute the next line of analgesia management. But that is not the reason for using it for long duration surgery. Long duration surgery, we need to come out of the opioid effect. That is why remifentanil is popular. Okay, that is something to do with the context sensitive half-life rather than the other side effect called possible hyperalgesia. Hope it is clear. So any doubt, if you need any further explanation, please post in the WhatsApp group. So I again request all the registered delegates to join the WhatsApp group. The link has been shared. If you have not received the payment confirmation email, it will be sent within a day. Okay. That confirmation mail also will have the WhatsApp group invitation link. If you have given a different number other than your WhatsApp number, please join the WhatsApp group. So whatever doubts you have pertaining to today's session or even subsequent sessions, anything related to the exam pattern, the preparatory method or anything, you can put in that group. So as a group, we'll learn together to face the Olympiad. I think next, Dr. Rashmi.
Yeah, so the next question is assertion reason type question. So the assertion is that solubility of oxygen in plasma is 0.003 ml of oxygen per 100 ml plasma for each millimeter mercury PaO2. And the reason is the R statement says that blood transfusion in anemic patient will improve the oxygen carrying capacity of blood. So you have all the four options. Read the two statements very carefully and pick the correct option out of the four initial statements that were given. The first one was that both A and R are correct, and R is the correct explanation of A. The second is both are correct, but R is not the correct explanation. The third is uh, I think both are false, and the fourth
No,
is
third is A is correct, but R is
okay,
incorrect. Fourth
right,
is A
and
is incorrect, R is correct.
okay,
So in the exam, you will get the statement and the options together in a single window. This is only because of the Mentimeter's convenience. We have put it like this. Okay. The WhatsApp group I was mentioning was Olympiad delegates WhatsApp group. Your confirmation email, I am deliberately putting that WhatsApp group invitation because rather than me adding, you can just click the invitation link and join because some people have kept the security feature that some others cannot add them to any group. So you can voluntarily join, click and join so that you will get updates regarding the mock session, the training materials, everything will be discussing through the WhatsApp group. The link will be through your payment confirmation email. Okay, even the provisional confirmation email, I have included that because once you all of you are joining the WhatsApp group, the communication becomes faster. Okay, we'll go to the responses.
okay. So I see that the majority have said that both are correct, but R is not the correct explanation of A, which is the correct option. A few of you have also said that it R is the correct explanation, but here I would like to say that the oxygen carrying capacity, the hemoglobin, there is a bound oxygen is bound to hemoglobin and there is a dissolved oxygen in the plasma. So when you transfuse blood in anemic patient, you are affecting the first part, which is the oxygen which gets bound to hemoglobin. Whereas dissolution, the dissolved plasma is not affected by the administration of blood transfusion. So therefore, the reason was not the correct explanation of A, of the assertion. Both are correct because, of course, it is going to increase the oxygen carrying capacity of blood because that is a combination of both these dissolved plasma as the dissolved oxygen as well as the oxygen bound to the hemoglobin. So you can go back to the equation of the content of oxygen in the blood and you can see that there is a plus sign between these two variables, but only the part of hemoglobin bound will increase when the blood is transfused. So that is why the correct option was option B.
Okay, we have left with one more practice question. The assertion statement A says nitric oxide dilates pulmonary vascular beds. Reason statement, nitric oxide stimulates the production of cyclic adenosine monophosphate, CAMP. Okay, we'll go to the options. 30 seconds. The choices remain the same. So assertion statement says nitric oxide dilates pulmonary vascular beds. Reason statement, nitric oxide stimulates production of cyclic AMP. Okay. Option A and C. A is the majority option. No. Actually, the correct answer key is C. Assertion is correct, but reason is an incorrect statement. Okay. Assertion is correct. Second statement that the nitric oxide stimulates the production of CAMP is an incorrect statement. So these are some of the model questions we wanted you to be familiar with. Okay, in this session we have tried to explain the format of the exam, the rules and regulations, how the markings are done. We have introduced you to the three sections, section A, section B, section C. Sample questions we have introduced. We have mentioned about the technical requirements, what you need to keep ready. And we have 3 more preparatory classes. Next session will be on next Friday, 8 p.m. Next Friday, we'll start exactly at 8 p.m. because all our ICA programs, we are very particular that we should start in time. Today, anyway, there was some entry technical issue, so we got delayed. So we'll start sharp at 8 o'clock. The platform will be open for the delegates from 7:50 p.m. onwards. So no need to try before that. After 7:50, click on the link, validate yourself with your mobile number. Okay, in case your mobile number is not validated, register fast and again come back to the same link. Click the same link, same registration link. Now you will be able to validate with your mobile number and then join the meeting. Over to Jayshree ma'am for your remarks and conclusion.
That was absolutely great, Sanish. Just students, it just shows the amount of hard work that Dr. Sanish has put in with his team, of course, for this Olympiad, which we are really looking forward to in April. And I could see in the chat box and how the students have felt. It means a lot, and I'm so glad. And I wish you all students, all of you, the very best of luck. Of course, we are going to have. Are we going to have another practice session? They are
Yes,
asking.
yes.
Yes.
Next two Fridays and March 25, Tuesday, 8 o'clock, same time.
So that's it. And so students study hard. I think Dr. Sanish, they also wanted to know any book that you recommend, so they could probably email you and find out all these answers.
Right now, it's
So
not there. Like we'll search it out. We'll search it out. It's all a combined effort. Right now, I
exactly.
don't have an answer.
That's true. That's true.
In future,
So
we will try to bring in an Olympiad, ICA Olympiad question bank book or something
yes, I'm
in
sure you
future.
will. So thanks a lot, and students, good night and happy and practicing and looking forward to meeting you in April. And of course, Anisha will meet you earlier as well. Okay, good night. Thanks, Sanish, Rashmi, and Baljit.
Thank you.
Sorry, hi, Baljit. Yes, yes. And thanks, Momita.
Thank you very much.
Great effort, Saneesh. Great effort.
Thank you.
Congratulations.
Thank you, sir.
Wonderful. I'm amazed at the amount of work that you have done and how much time you must have put in along with your team. Great. You are
Thank
amazing.
you.
Good
Thank
night.
you, sir. Thank you,
Good night.
ma'am.
Okay, good
Thanks,
night.
Dr.
Good
Rashmi.
night, dear.
And good
Good
night.
night.
Thank
Thank
you
you.
so
Good night.
much, ma'am, and thank you so much, sir, for giving us this opportunity to host the session. So, with all your permission, I'm closing the session over here. And good night to all of you. Thank you.
Good night, Mom.
Thank you. Thank you.